Eye health, a very important thing and something a lot of people actually do overlook. See what I did there? I love getting my puns in on this one. Once again, from Total Eyecare, we have Andrew Koch joining us. And Andrew, a couple of weeks ago, it was actually Diabetes Awareness Week. And what some people probably don't realise is that disease can have a pretty big impact on your eyesight.
Diabetes affects the blood sugar in the body, but what that ultimately does is affect the health of the blood vessels in the body.
Right.
Now, in the eye, we've got a clear window in to see the blood vessels in the eye. They're very fine vessels, and we can often see changes to the vessels caused by diabetes. Now, if the blood vessels in the eye are suffering, then we know that there are blood vessels are also suffering in maybe in the heart, the kidneys, the feet, and other areas of the body.
Right.
So the eye's a really important place to look.
You could really say that the eyes are the window to the soul or the rest of the body.
That's right. And you might not realise, but diabetes is the leading cause of blindness in working age adults.
Wow. And I would imagine that not many people are aware of that fact, because you do see those ads and people talking about it, but sometimes it's just white noise and you don't take it in until you go and get an eye check with you guys and get told you might need to go and see your GP.
That's right. Our friends at Diabetes Tasmania have told us that there's 25,000 people in Tasmania diagnosed with diabetes.
Wow.
And that means that there are about 6 new diabetics every day being diagnosed. So this is something that's not going away. It's something very significant.
Oh, my Lord. And, of course, on our 7HOFM website, 7HOFM.com.au, people can go in and pose some questions to you. And I understand there's been quite a few about diabetes.
That's right. There's been a lot of interest in diabetes, and we're putting up a new blog there with some information for everyone to read as well.
Now, what are some of the big issues that people do raise with you when it does come to diabetes? Do you get people that have been long-time sufferers with the disease and people that didn't have a clue they had it?
Well, it's both. It's often that at Total Eyecare we're the first person to see that someone has diabetes because we can see it in their blood vessels. But often GPs refer their patients to us to have their eyes looked at. Right. And at Total Eyecare, when we do diabetic eye examinations, we take digital images of the retina. And this helps us to diagnose and to monitor what's going on. If you take digital images, you can actually see changes over time, and therefore you can make early judgments. Because this is so important, we've just installed the latest technology, a wide-field digital retinal scanning instrument, which just came yesterday. It's the latest Optos, and it gives us the world's best view of the whole retina and all of the blood vessels right to the periphery. This means that eye examinations for diabetics have never been simpler and more detailed. And with this technology, we can see much more, and we can find significant signs and really give us something to work with.
And obviously, you would recommend to people with diabetes or those sort of eye issues to come every year or so and have another look at?
Yeah, definitely. Most GPs tell their diabetic patients they should have their eyes checked every 1 to 2 years. If everything's going well, sometimes it can be 18 months or 2 years, but certainly if they're managing and trying hard to keep their health more online, then certainly every 12 months and sometimes even more often is important.
Wow. And are there a lot of shocked customers coming in, shocked clients going, I didn't have a clue?
Well, it's always interesting because when you take a personal approach and look at people's individual eye health, and we have conversations every day with people, and you can talk to them about their eye health, and sometimes you can fill in gaps that give them that aha moment because it actually makes more sense. And I think that's what I love about the sort of work I do, because it is personal, and I spend a lot of time with people. And in fact, at Total Eyecare, every optometrist that we have has got more than 10 years clinical experience. So I work with a great team, and they've got a lot of experience and knowledge, and they know what to advise people and make it easy for them.
And obviously, as you say, it allows that person that was completely unaware to make more informed decisions, and also information is often power. So if you've got that information, then you can make some lifestyle changes that you might need to be making.
Definitely, because caring for your eyes and your health and keeping your body in good condition is a vital priority. By the time you experience health changes and vision loss, it's really an uphill battle to get anything back. So being proactive, having your eyes checked, having a preventative eye care plan, having an optometrist that has got a plan for you and can monitor you and give you that advice.
And that's the thing, I suppose, because going to the dentist and probably going and getting your eyes checked and that sort of thing comes low on the list for some people. They think everything's probably okay and they just squint and get on with life. But they really should be coming in to have a chat and having an eye check on a regular basis, because you could find some underlying health problems they were completely unaware of.
Yeah, I know. And as you know, there's plenty of optical retailers out there, and they all provide glasses. And I think it's important to choose a provider that you've got confidence in, that they can provide you with the best personal eye care and a monitoring plan for your eye health, especially if you have diabetes.
And as you've often spoken about, you've got those generational relationships where Nan and Pop came to see you guys, and now their children do, and now their children do. So you have that amazing snapshot of a family's health history, as well as that back knowledge of some of the issues to look out for.
That's right. No, it's really good being part of a community, but also when we find out what patterns have been happening in a family, we can look at risk factors, and we can often identify what a risk factor is for somebody and then monitor appropriately, even if they don't have that condition at that time. Young people often are healthier than middle-aged, middle-aged often healthier than older people, and things change over time. And when you get a database on someone's eye health and you look at changes over time, we can often pick things up before they would become very obvious.
Well, this is it, because, the eyes, there's a lot going on there. We just see, just the cornea and what we look at, but behind the eye, there is so much that can be discovered with the scanners, and also that new scanner and photography device that you have now. It would uncover some very interesting things.
Yeah.
So you're saying maybe, people that are approaching middle age, you're in your 40s, in your 50s, maybe haven't been to see an optometrist in years or ever gone to see one, that now would be that prime time to just make the appointment and go in and have an in-depth look about what is going on behind your eyes.
That's right. Be proactive.
Yeah.
And Total Eye Care's got 9 locations around Hobart. We're convenient. We've got experienced optometrists. We're available, and we're here for you.
That is fantastic. So if you do want to find out a bit more, or maybe you have a question or want to find out a bit more about diabetic and eye health, you can go to 7hofm.com.au, and Andrew and the team at Total Eye Care do a wonderful blog just covering off on those issues, and then you can pose any questions you might have, and we'll have a look at them. I did it again. We'll have a look at them next month with you, Mr. Koch.
Yeah, great. Thanks, Jane. Very nice to see you again.
Yes, I can see you too.